Doctors and healthcare workers are working round the clock without any breaks to treat patients amid a deadly second wave of COVID-19 in India. One overworked and traumatized doctor from Mumbai made a desperate appeal to the people of the country through a video message. Dr. Trupti, an infectious disease specialist, broke down in tears as she requested everyone to mask up in order to save more people burdened by an avalanche of COVID-19 patients. The doctors said the healthcare sector is helpless as they have never really seen such a situation before.
बॉम्बे की हालत तो बहुत ख़राब है और धीरे धीरे बहुत सारे शहरों की और बहुत सारे स्टेट्स इवन टाउन्स की हालत ख़राब होते जा रही है। बॉम्बे की हालत तो इतनी ख़राब है कि हमारे हॉस्पिटल्स में आईसीयू बेड्स वेटिंग पे है, पेशेंट्स के लिए बेड्स नहीं है। इट्स अ वेरी वेरी हेल्पलेस, यानी मुझे इतना हेल्पलेस और लाचार कभी फील नहीं हुआ है। We have to literally manage patients at home with oxygen, and this is not something we are enjoying. So I really want all of you to follow a few things that I really am requesting you to follow. First, आप लोग प्लीज सेफ रहो। अगर आपको लग रहा है कि आपको 1 साल से कोरोना नहीं हुआ है इसलिए आप कोई सुपर हीरो हो या आपकी इम्यूनिटी बहुत अच्छी है और आपको ऐसे कुछ नहीं होगा, तो आप गलत फहमी में हो। हम यंग लोगों को देख रहे हैं। I mean, we have a 35-year-old who's on the ventilator and we are not able to help people now. So we do not want, we really don't want any of you to be in that situation. So, sorry. I think ये जो इमोशनल ब्रेकडाउन है हम डॉक्टर्स में अब सबको कोई ना कोई समय हो रहा है बिकॉज we've not been so helpless. Okay, so most importantly, please take care of yourself. Right now COVID is everywhere around you. Okay, तो अगर आप घर से बाहर निकलो, maybe you're meeting your friends, maybe you're meeting your family, it does not matter, you have to be masked. Okay, just because आपको अभी 1 साल से कोरोना नहीं हुआ है या आपको पिछले साल कोरोना होकर जा चुका है, इसका मतलब ये नहीं है कि आपको वापस कोरोना नहीं हो सकता। यू कैन स्टिल गेट कोविड। तो प्लीज कीप योरसेल्फ वेरी वेल मास्क्ड एट ऑल टाइम्स।
A basic thing that a doctor is asking for. Breaking down in tears, Dr. Trupti, in fact, who's been behind this battle against COVID-19. She's been fighting very hard for the last 1.5 years, breaking down and saying, please mask up. That's the least we can do. Well, India's Desi jab, Bharat Biotech's Covaxin, now has been found to be effective against the double mutant strain that is believed to be partly behind the massive surge in COVID-19 cases in the country. India's premier research organization, the Indian Council of Medical Research, has now revealed that Covaxin effectively neutralizes the double mutant strain, which, remember, is predominant in the country right now, and is also effective against other variants like the UK variant and the South Africa variant, both of which have been seen in the country. ICMR says the studies have shown that Covaxin is effective against the UK and the Brazil variant as well. A development comes amid concerns over whether vaccines available with India will work against the new emerging strains of the virus. Meanwhile, as India gears to open up vaccination for all above the age of 18 from the 1st of May, India Today's Rahul Kanwal spoke exclusively to Serum Institute's Chief Executive Officer Aaditya Poonawalla a short while ago. Listen in to this conversation.
What will the price of these vaccines be? You'd earlier mentioned 1,000 rupees. Your company's put out a press release saying in private hospitals it will be 600, state governments 400. Can you explain the rationale of your pricing decision?
Yes. So we have also disclosed a table and a chart of what global vaccine prices are at, which is, usually more than $10 or $20, which is upwards of 700-800 rupees, and some going into 2,000 to 3,000 rupees per dose. Now, we have chosen not to make, or take advantage of the situation by charging ₹1,000 price, which is what I originally hoped I would do. That is something we could look at after 6 months or 7 months when the pandemic is sort of easing down, when we sell in the private market. Right now, we're selling to the state governments and private hospitals, which we feel we need to, in our philanthropic nature, which we've always believed in giving affordable healthcare products, that we substantially bring it down, from ₹1,000 to ₹400 for state governments, and as you rightly said, ₹600 for private hospitals. So that is why we have done that as a gesture to support the people so that everyone can afford these products.
All right, but after the Delhi government sent an SOS to the Centre of Oxygen Supply, breather for some hospitals in the national capital. Fresh supplies have begun arriving in some hospitals. Delhi's GTB, LNJP, Sanjay Gandhi, Deen Dayal Upadhyay and Sir Gangaram hospitals have received oxygen supply late at night. Many other hospitals are expecting supply today. GTB hospital has received 14 tons of oxygen. LNJP has been supplied 10 tons of oxygen. And with fresh supplies coming in, they have enough oxygen to last through the day at least. Delhi government yesterday apprised the centre of fast depleting oxygen supply, saying some of the major hospitals were left with just a few hours of supply. Apart from Delhi, Maharashtra and Rajasthan government also have asked the centre to provide oxygen to the states.
कोविड पेशेंट को लेकर आए, क्या कह रहे हैं हॉस्पिटल वाले?
नो ऑक्सीजन, नो बेड। ओखला ही है सही में।
कहाँ पे बैठ गए अभी? आप काम क्या करते हैं अभी?
मैं जीबी पंत में एक्सरे डिपार्टमेंट में थी, रिटायर्ड हूँ।
We did receive through government of Delhi also and also from our regular supplier, and we have received almost 12,000 cubic meter of oxygen, which will be sufficient to run the hospital for another 24 hours. On daily basis, we require approximately between 9,000 to 10,000 cubic meter of oxygen. So I have sent request to government of Delhi to send the same vendor again to supply around 5,000, so that we are today and tomorrow at least we are safe.
हमारा जो पर डे ऑक्सीजन का खपत है वो 20 से 21 टन हो गया है, यानी कि 6 to 7 टाइम डिमांड बढ़ गई है। और जो हमारी कैपेसिटी थी वो सारी, उससे भी हम ज़्यादा सिलेंडरों पर भी हम पेशेंट्स को डाल रहे हैं। उसके बावजूद भी हमने ये देखा है कि क्योंकि हमारे साथ लोकनायक के सारे बेड फुल हो गए हैं और ऑक्सीजन का बहुत ज़्यादा क्राइसिस है, डीएम साहब को भी और सारे जो अधिकारी हैं सबको हमने बताया कि हमें आज ही 10 टन और चाहिए, अदरवाइज़ तो हमारे जो आईसीयूज़ हैं और जो बाकी के पेशेंट्स हैं उनको जो ऑक्सीजन की रिक्वायरमेंट है वो कंप्रोमाइज़ होगी और जो सर्विसेज हैं कहीं ना कहीं वो बाधित हो जाएंगी।
Well, we know that oxygen is required not just for patients who are in fact getting hospitalized, but also for many patients who are recuperating at home and are under home isolation. Well, let's give you a situation of how Delhi hospitals are coping up as far as the oxygen stock is concerned. The Deen Dayal Hospital in Delhi has oxygen supply for 24 hours. The Ambedkar Nagar Hospital has got oxygen supply for 24 hours again. The LNJP Hospital has oxygen supply for just 12 hours. Rajiv Gandhi Hospital for 11 hours. Sanjay Gandhi Hospital for just 3 hours. Batra Hospital in Tughlakabad in Delhi for 9 hours. BLK Hospital in Pusa Road in Delhi for 48 hours. The Holy Family Hospital in Okhla for 9 hours, and the Max Super Specialty Patparganj Hospital branch for 20 hours. The Sir Gangaram Hospital, which by the way is a COVID hospital, dedicated hospital, has got the supply of oxygen left for just 24 hours. And this is data from the Delhi government, and this is the latest data up until 8 this morning. Meanwhile, my colleague Anisha Mathur in fact sent us this report earlier about long queues of people being seen outside hospitals and testing centers as COVID-19 cases are increasing in Delhi. India Today's Anisha Mathur gets us this report from Burari Hospital. Take a look.
COVID cases exploding in the city, more than 28,000 fresh cases in the last 24 hours and more than 270 deaths in the capital. And more yet to come today as the city is reeling under an oxygen shortage. Most of the hospitals, including government and private hospitals, have said that they have only a few hours worth of oxygen left. as the centre and Delhi government scramble to arrange oxygen for all the patients who need it in the capital city. We're right now at the Burari Hospital, which is a Delhi government hospital, where you can see hundreds are standing in line for getting the COVID testing done. And the line you can see is not maintaining social distancing. So even though we are dealing with a massive surge of COVID cases, people are still not following the distancing norms. As you can see, people are standing in groups even outside the hospital testing center. And that is something that is going to add to the numbers, as most of these people are here to get tested, which means that most of them do have some sort of symptoms or have been exposed to some COVID positive patient. And this is something that is very, very dangerous, as the city is reeling under a shortage of oxygen, beds and medication. In New Delhi, with cameraman Dharmendra, this is Anisha Mathur for India Today.
Well, the situation no better in UP's capital city of Lucknow, which is also facing shortage of oxygen. People are queuing up at oxygen refilling centers but are not able to get oxygen cylinders.
Lucknow is facing the unprecedented crisis of oxygen. Oxygen gas cylinder, liquid oxygen gas. I am right now at the industrial area in Lucknow, from where you can just see the people coming here for their kith and kin. They are in hospital. I'm just talking to a few of the people. Did you get the cylinder here at?
No, not at all. No, not at all. Because my patient, my father is admitted and he require O2. Hospital raising their hand. We don't have oxygen. Arrange yourself. So we came here to get the cylinder, O2 cylinder. But all of a sudden, police came and said कि it is an government order. You will not get a cylinder.
सुबह से लगे हुए 5 बजे लाइन पे सर, मरीज घर पे पड़ा हुआ है. हमारा 5 बजे से दौड़ रहे हैं, यहाँ से लाठी लेके चार्ज कर रहे हैं. लाइन लगे, नंबर आया तो भगा दिया, सिलेंडर लेके भगा दिया उन्होंने.
किसी भी आप गैस एजेंसी पे चले जाओ ऑक्सीजन लेने के लिए, कहीं नहीं मिल रही है गैस. लोग सुबह 6-6 बजे से लगे हुए हैं सर. और ये ऑक्सीजन को हम घर में जाके बेच नहीं लेंगे या कुछ इस्तेमाल नहीं कर लेंगे. पेशेंट के लिए चाहिए जो मर रहा है.
आपके लोग हॉस्पिटल में ही हैं?
जी सर, हॉस्पिटल में है.
और वहाँ हॉस्पिटल वालों ने भी हाथ खड़े कर दिए?
बिल्कुल बिल्कुल, गैस है, उनके पास ऑक्सीजन नहीं है.
You can just see the administration coming here, ADM Lucknow. Many top officials are just rushing to this site for the cylinder. You can just see this. This is the situation here. This is the grim situation, because all the top officials are now coming just to meet the demand of this oxygen cylinder. Now hospitals have raised their hand. They are unable to provide the gas cylinder, and this is what the ground situation here in Lucknow. With Amit Gupta, this is Kumar Abhishek in Lucknow for India Today.
Well, there is a scramble for oxygen, not just in Lucknow, but in Delhi, Mumbai, Kolkata. Many cities are reporting shortage of oxygen. But what is this oxygen supply? When do you really need oxygen? Here are the most frequently asked questions on oxygen, and when, and these are answers perhaps that's going to help you understand when do you really require oxygen support. If there is shortness of breath in a patient who's in home isolation, if this is being seen, that's when you need to check with your doctor if oxygen supply is required. Falling blood oxygen level is when you require oxygen support. Well, how does this really happen? In fact, how does COVID trigger a crunch in the oxygen supply? What really happens, and why does your oxygen level dip essentially if you've been infected? It infects and inflames the lung cells, and that's when you require oxygen. It triggers a fluid buildup in your lungs, something that has been seen in many patients across the world. 54.4% people require oxygen in the second wave, and there's been an increase in the first wave. In the second wave this time around, if you compare it with what really happened in the first wave in the country. Ventilator requirement is actually down to 27%, is what the government has also been saying. When do hospitals give oxygen? Oxygen level below 92%. So this is something that you need to watch out for. Below 92% is when everybody thinks about giving oxygen to the patient. Hospitals also think along those lines. When do hospitals give oxygen again? When in 88% in chronic long ailment cases, wherein patients are having the long ailment, is when hospitals consider giving oxygen. Will I see COVID symptoms if oxygen level is down? Well, there's no connection essentially. You can be short on oxygen, yet not be breathless. So do not think that only if you are breathless, that's when you require oxygen. Your oxygen level possibly has dipped and you'll not even know. You'll not essentially be breathless for that symptom to come up. Will I see COVID symptom again if oxygen level is down? The key is monitoring the oxygen level all the time. Like I just mentioned, there will be no symptom essentially for you to get that indication that you perhaps require oxygen, but you need to continue to monitor. In fact, every single waking hour is when the oxygen of a patient at home must be monitored. Let's talk about the situation in Maharashtra that continues to be the worst hit state in the country. The government has hinted at a lockdown from today as cases continue to surge. However, sources have revealed that there is going to be no complete lockdown in the state, but strict curbs will be in place to ensure containing the spread of the virus. Restrictions are likely to be in place at crowded places and markets, and there would be a ban on inter-district travel. Yesterday, Maharashtra cabinet suggested that there is no option but to impose an even stricter lockdown in the state. Maharashtra already has sweeping lockdown like curbs. The Chief Minister, Thackeray, is going to take the final call on lockdown later today. The state government yesterday announced new measures to combat the infection. All shops, including grocery stores, will remain open between 7 a.m. and 11 a.m. Home delivery is going to be allowed only between 7 a.m. and 8 p.m. Maharashtra reported over 62,000 new cases and 519 deaths on Tuesday, taking the total active case count to over 6,63,000. Meanwhile, Mumbai recorded 7,214 new cases and 35 deaths.
लॉकडाउन के बारे में माननीय मुख्यमंत्री जी डिसीजन लेंगे. उनको यानी क्या अभी तो रिस्ट्रिक्शन शुरू है, लेकिन इसमें और क्या बढ़ोतरी करना ज़रूरी है, क्या क्या और बंद करना ज़रूरी है, ये इसके बारे में जो लिस्ट है वह काम करने की जो प्रक्रिया है वे चीफ सेक्रेटरी ऑफिस में अभी जारी है. मैंने अभी बात किया है तो उसके बारे में जो भी रूल्स एंड यानी डूज एंड डोंट्स है वो इशू की जाएगी. और मुझे लगता है कि ये जो रेस्ट्रिक्शंस है उसमें 100% हम और स्ट्रिक्ट रेस्ट्रिक्शंस करेंगे, उसमें और बढ़ाएंगे.
कहीं ना कहीं आप देखो मुंबई में भी 10,000 से लगभग 7,000 तक हम केसेस आ जाए हैं, कभी 9,000 आ रहे हैं. ये थोड़ा ऊपर नीचे हो रहा है, लेकिन अभी इस पे हम कोई सेटिस्फैक्शन नहीं जता सकते. हमें केसेस और नीचे लाने ही पड़ेंगे एंड द ओनली वे अहेड एज ऑफ नाउ टू ब्रेक द चेन इज अ लॉकडाउन. कोई भी इन्फेक्शन ये कोविड का होता है, अगर आप पिछले साल भी देखो तो 3 दिन का लॉकडाउन, 5 दिन का लॉकडाउन ये मायने साइंटिफिकली रखता नहीं है. ये 2 हफ्ते तो लेता ही है, क्योंकि फर्स्ट रेट ऑफ ट्रांसमिशन, फिर दूसरा ट्रांसमिशन. अगर आप फर्स्ट क्लोज कॉन्टैक्ट्स में हो, हमें खुद को पता चलने में कि हमें कोविड हुआ है, शायद एसिम्प्टोमेटिक से लेकर सिम्प्टोमेटिक होने तक एक केस को लेके 5 से 7 दिन लगते हैं. लेकिन हमें यकीन है, हमें यही उम्मीद है कि अगले 15 दिनों में केसेस उतरने शुरू हो जाएंगे. और अभी हमारा यही फोकस है कि ज्यादा से ज्यादा लोगों को इस इन्फेक्शन से दूर रखें, अपने घरों में रखें.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.